Good day, my student. Within the next few slides, I'm going to discuss the altered cast technique. So what is altered cast technique? It is one of the techniques that have been used to provide functional ridge form in a freehand extension in addition to the anatomic form. This means that we have two forms. One of them is the functional form and the one of them is the anatomical ridge form. Altered cast technique, this is to provide the functional ridge form. So what is the main aim of this technique? The main aim of this technique is to obtain the best desired support for the RPD wear in the mandible disc extension. This means class 1 and class 2 in the freehand extension of the mandible, which means bilateral and unilateral freehand extension. It is rarely used, actually, altered cast technique in the maxillary arch. Why? Because of the nature of the masticatory mucosa and the amount of the firm palatal tissue present to provide soft tissue support, which is not the picture in the mandible. So what is the method of impression? It's kind of method of impression. The mandible disc extension partial dentulus, like in canine class 1-2, requires some selective tissue placement. Why? To obtain the desired support from these tissues. So it's kind of method of impression. This variability in the tissue mobility is probably related to the pattern of the mandibular residual ridge, because as in the mandibular residual ridge resorption, it's more in the lower than in the upper arch. And that is why a second impression made in trays, which is attached to the framework only, makes definite board of control and tissue placement a bit easier if you compare this with the individualized full arch tray. So it's kind of second impression, which is attached to the framework. By this, the result is a potentially more stable RPD that improves the support for the occlusal relationship of the opposing dentition and the non-porcelain restoration. And by this, we will get a stable RPD that is a stable occlusion, and by this, we are reducing the pattern of the bone resorptions, and we are also reducing the torque on the abutment teeth. If you look at this slide, to start with the lab procedure, we can see that the framework has been tried on the mouth and fits the mouth and the master cast as a plant. This is the master cast where the framework has been tried in the mouth and fits here. And here I would like to remind you that this is not the refractory cast. The framework is processed on a cast which is called the refractory cast. The main purpose of the refractory cast is that the casting procedure cannot withstand high temperature, and that is why the casting process is done with a cast called refractory cast. The outline of the acrylic resin trays is penciled here, as we can see. Now, the next slide will discuss this. It's one thickness of base plate box is adapted to outline to act as a spacer, as you can see here, so that room for impression material exists in the finished tray. Windows are cut in the wax spacer corresponding to regions on the cast, contacted by minor connectors, which is called tissue stops for denture base, as you can see here, 1, 2, 3, 4 tissue stops. Now the framework is warmed and pressed to position on the relief master cast, as you can see here. For regions of cast that will be contacted by the autopolymerized acrylic resin or visible light cured resin are painted with tinfoil substitutes called alcohol or motor-released agents, which is called MRA, and this is all of these will act as a separating medium. Now here, the acrylic resin material is adapted to the cast and over the framework, as you can see here. Excess material over the borders of the cast is removed with a sharp knife while the material is still soft, and I advise you to do this while the material is still soft. Now the acrylic resin trays and the framework, which is called the assembly now, are removed from the cast, and the trays are trimmed to outline the wax spacer, as you can see here. So now we have got a special tray with a framework, which is called impression framework assembly. Here, the borders of the tray will be adjusted to extend 2 mm shorter of the tissue reflection. Holes will be placed in the trays corresponding to the crest of the residual ridge. So here, the holes will be placed here in the trays corresponding to the crest of the residual ridge and retromolar pads. Why? To allow escape of the excess impression material when the impression is made. Now, by this, we have prepared our special tray on the framework. If we come back to this slide, this is not the same case, but this is the same process. So someone of you may ask, this case is different, this case is different. Yeah, but it's the same principle. I just want to show you what's going on in the cast. The broken line indicates the proposed cast modification for a bilateral corrected cast process, as you can see here. These dotted lines. Now, the master cast following the modification. So it has been carried out. Now, if you see a properly bordered molded impression tray, so it's ready to take an impression now. Okay, now it's completed rubber-based impression. It has been taken. Let's go back to our cast. We are seating now the impression. So the framework impression assembly is properly seated on the modified master cast, you can see, but we need to fix it well. So at this stage, the framework should be affixed to the modified master cast using molded plastic or anything that can fix the framework impression assembly very good to the cast. This minimizes, why? Because this minimizes the likelihood of the displacement and the distortion. So we need to be fixed well. Now, the assembly is inverted in preparation for rimming and boxing procedure. Sometimes we call it beading unboxing. As you can see, utility wax is used to rim the impression. For the beading, sometimes we call it, the utility wax should be located 2 to 3 mm from the impression borders. It should extend peripherally about 3 to 4 mm. Now, boxing wax is added. As you can see, we box it. Is added to form a watertight vertical wall. When this has been accomplished, now freshly mixed dental stone is introduced. So when you pour the stone inside, you will get a good cast. So you can see it has been changed, it has been altered the cast. Altered cast technique, we altered the cast. And now, after the stone has gained sufficient strength, the corrected cast is recovered and trimmed. So this is why it's called altered cast technique. By this, we have reached the end of our slide presentation. Thank you very much, and I hope that you have gained the comprehension of the idea of altered cast technique. Please accept my warm regards from prosthodontic departments at Warwick University. Hoping to see you again in another slide presentation. Good day.